say. Yeah, you especially. Oh, no, you. Fred, so according to the agenda, executive session, is that the way you want it?
At the end of your committee, yes.
Okay. Okay, you can absolutely. Make sure that's the right. What I want to do. Everybody got an agenda just before I get going?
Yeah.
Okay, we'll go ahead and get things cranked up here.
Thank you.
We'll start with pledge to the flag, please. I pledge allegiance to the flag, United States of America, to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all. If I could ask for a moment of silence. Thank you. Oh, yeah, absolutely. You want what the other one do?
Just because I'm no.
No, you're more than welcome. Okay, real quick, members present, McNabb Coleman has been excused. Petcher is here, Whitetail is here, Winslow's here, and I'm here myself. Believe it or not, I'm here. So we'll start off minutes to approve for the April meeting.
Move it. Second.
I have a motion and a second. Any discussion on the minutes prior last month? Hearing none, all in favor?
Aye.
Any opposed? Carried. Thank you. I do have a list of appointments. These are just for notification only, and be honest with you, I went to, over here a while ago, I went over, after our fire advisory board meeting, and asked if I had to sign the thing, and she said, no, there wasn't any resolution. And I know the night of our fire advisory board, a bunch of us signed, papers at the meeting to be taken over. And apparently they're mysteriously missing. So we have to do we have to go and get appointments again because it's over 30 days to sign at the clerk's office. I don't understand.
I'm sorry, I don't.
For our fire advisory board, we had that night of our meeting.
Yep.
We all signed, we had paper to sign to say we were, accepting the position as, like, instead of going over there.
The thing that Christine Lytle talked about yesterday.
Yes, is Christine here today?
No.
No.
Oh, the oath of office.
The oath of office.
Said I'm not bringing books anymore. We just have paper, you sign it and I bring it
So
back.
that's what we did last month at our last fire advisory board. Well, I happened to be in the office because I had to sign for another one. And I asked to make sure that the fire advisory board one was okay. And she said, I don't have any paperwork or anything for you to sign.
I wonder if Christine,
So now
to Christine?
I didn't give him, it was the chairman of the fire advisory board, not me.
Okay,
I'm just a,
yeah,
Something must have
Middleman.
lost in the shuffle.
yeah.
so what we have to do is we have to reappoint all those positions at the end, at the full ledge. So
Yep.
just for information only. With that, department updates. We're going to change things around a little bit because we've got some folks that got things to do. So I'm going to start right off with Mr. Thomas Tyrone from probation.
Hello, thank you. I did send a department committee report. The command is gonna attach it. I just missed it or something. So the only thing it really said was working on the plan for our block grant for probation, and then working with Fred on things for potential couple fees that we might be able to collect to do something. So I just don't want to really go into that till I know whether it's feasible or not.
Tyrone, you have two resolutions, JP4 and JP5. You want to cover them real quick?
Yep. First one is to fill probation officer one title just we had somebody resign. And so just looking to fill that position.
Yeah, that would be JP five, authorization to fill one probation one title in the Cayuga County Probation Department.
Move it.
Have a motion? Need a second?
Second.
Motion and a second. Any discussion on JP five? Hearing none, all in favor?
Aye.
Any opposed? Carried. JP four.
This one is to create and fill a part-time probation officer we had the position cut and we've just been struggling. So we were looking to hire somebody to get some help, and looks like we can cover the expense through our current budget.
Is this the one that we talked about in the meeting?
Yeah.
Currently, we have somebody that's past probation officer, is that correct?
Yep, one of our retired probation supervisors is willing to come back and do it.
And he's willing to come back in for part-time?
Yep.
Very good.
I'll move it and you just answered the question.
Okay, I need a second.
Second.
Any other discussion? Hearing none, all in favor?
Aye.
Aye. Any opposed? Carried. If anybody has anything for Mr. Thomas, speak now or hold your peace because he's running out. Thank you, Tyrone. Appreciate it.
Yeah.
Next up would be our district attorney, Brittany.
Good afternoon, everybody. I don't have any updates or resolutions. We did just finish our grand jury term this week, so we'll be starting a new one next week. So they'll be trained and they serve 16 to 17 weeks, depending on where they fall in the schedule. So we'll get a new group, but we're very grateful for their service for the last 16 weeks that we've had them. So other than that, I don't have anything else unless there are any questions.
Anybody have anything for our district attorney? Thank you.
Thank you so much.
Yep. Next up, 911 center, Ben. And I'd just like to, everybody probably most of us know Ben Guzlak. He is the 911 fill in for. I guess I kind of really try to be nice and.
Interim, yeah.
Interim, there's the word. I'm not all up on fancy words.
We're filling.
Well, I don't have a lot to add to the report that I did. We did do the interviews that I mentioned there, Monday and Tuesday. We actually are going to do a few more. We got a few more candidates. We want to as big a pool as we can because it's a challenging job. So we want a good pool to pick from. The only other thing I will add is my IT myself, working with Motorola. We want to use the two radio laptops that we purchased last May, and we have to set up a proxy server, and we'll be able to use them in the Auburn site while the other stuff gets figured out. Being able to do that would allow us to at least have a bare bones backup center where everything's in one place, phones, and the radio. It would be a lot better than our current situation. So we got another meeting on that on Friday, and I'll more of that. I'll make that over here around. Any questions?
Does anybody have anything for Ben? Oh, you got off like Ben.
Yeah, I just also want to add a lot of people reached out since I got appointed, offering their help and support from other departments, and I really appreciate that.
Very good.
How many vacancies do you have currently then?
We have, so we're filling two right now.
Dispatchers.
Two regular
Yep.
dispatchers, then we have two others that aren't approved yet, that I'm gonna be looking to get them approved hopefully soon. And then we also have two supervisor openings. Also, we only have two supervisors right now,
Out of four.
out
One,
of four, yeah.
Ben, we just had one step down.
Just up down the 1st of May.
Yeah. Okay, so that's one more than we anticipated.
And your training class is coming up soon?
Yeah, so the two that I'm interviewing for now, we're hoping to start them in June. And then we kind of got to stagger it because we have a limited number of trainers. Operationally, it's tricky, so we're gonna do these two, and then we're gonna try to do two more sometime in the summer.
Okay, you couldn't have done all four at once.
It'd be very.
Okay, all right.
We also have four people going through training right now as well.
Okay, thanks, Ben. I appreciate it. Good luck. And if we can do anything for you, please reach out.
Thank you.
Next up would be Sign Council, Mr. Lloyd Haskin.
Thank you, Chairman. You received my written report. If there's any questions or concerns? If not, I have one resolution.
Yes, I'm digging through my paperwork here.
Yeah, it, for some reason, didn't make the agenda. But thank you to Fred and Shireen and Lynn for putting it together, the account numbers and whatever. We are in receipt of a proposal in the amount of $700,000 over the next 3 years. I just want to read you just a snippet of it. This grant will provide us the opportunity to strengthen legal representation for parents involved in child welfare investigations through an intervention model. The proposal includes funding for a resource attorney and specialized services such as investigators, interpreters, mitigation specialists, and mental health experts. It also supports an attorney on-call system so families can receive immediate legal guidance during investigations. Our family court cases are on the rise. We assigned attorneys to 660 clients in 2024. That number jumped to 749 in 2025. We have assigned attorneys in 203 cases so far this year. These assignments are consuming 20 to 25% of our budget. For instance, in 2024, we spent $550,000. Last year, it rose to $814,000. The overall goal of this initiative is to improve access to quality legal representation at the earliest stages of a child welfare matter and promote better outcomes for family and children. It's also an attempt to leverage $750,000 in 100% state money, which could have significant impact on our local costs.
Lloyd, you man handed me this resolution. Apparently it didn't make the packets or whatever. I'm assuming it's just gonna be G11 at Ways and Means. Are you gonna be here, Elaine, for Ways and Means or?
Yep.
Oh, you are gonna be.
Yep.
I will not be. I'm sorry. So,
It is on JP 11 in the revised schedule.
Yeah, it was,
Right now.
they sent it out earlier by email.
They revised it by email very late, so it's.
okay, so I have it and I don't want to go through and read the whole thing, but I want to read the resolve that the 2026 assigned council budget be amended to accept the sum of $270,500 in parentheses for 2026 and the following budget amendments be made. Increase account number A11704.54290 by $270,500 and increase account number A11700.43073 by $270,500.
Revenue account, so it's a wash.
Yeah, it's a wash, basically. That's what I was getting to. So that will be JP 11. So I will need a motion.
I'll move it.
I need a second.
Second.
And any discussion on what will be JP 11?
Go ahead.
Are we going to be representing both sides in a family matter? Father and mother, or how is this going to work?
This is targeted for primarily Article 10 cases, which are neglect cases.
But meaning the county DSS
Oh.
represents them now.
Well, we
Yeah.
represent, DSS represents them and we represent. Same way in a criminal trial, we represent the defendant and the DA's office represents the people. So
Not really different, right?
no, it wouldn't be any different.
We can't win no matter what.
No, you can't.
On one side.
And Lloyd, this was unanticipated revenue, so this is extra than what you were planning on because the state somehow recognizes all the stress this is having on assigned council budgets?
Correct.
Or they don't feel the representation is as sufficient as it should be, or all of the above?
Combination of both. Historically, the ILS money, the state money has been funneled into criminal matters.
Mhm.
And now they're starting to recognize that, a large portion of our costs, 25% of our budget is in family court.
Mhm.
So they came out with this $750,000 over 3 years and we'll track that to see if if we can reduce some of those costs.
Mhm.
So, anybody, we have a motion and a second, all in favor? Any opposed? Carry. Thank you, boys.
The second thing, and I'm very cautious conscious about our assigned council budget because we, every year it raises and raises. So we're working on a second initiative, which may come up next month or the month after. Been working with the county attorneys from Seneca and Fred. We had another meeting today. Seneca County does not have an assigned counsel program. They only have a public defenders program. And our assigned counsel program has kind of been a model statewide because we're only assigned counsel. So we're looking at a model to merge Seneca County's conflicts. They still have a public defender's office, but whatever conflicts they have would come to Cayuga County and we would do the assignment of counsel, and then they would pay the bill on it. But with that, we've come up with an administrative fee, which we haven't agreed with Seneca County yet, but we're well over 100,000 for that in terms of an administrative fee, which would offset any costs that we would have.
You have the capacity, obviously, or you wouldn't be doing this.
Well, ILS is going to give us more resources.
No, I meant the bodies.
Yes.
The attorneys.
Won't take away from this.
Mhm.
No, it won't. No. And that's on the horizon.
Very good. Anybody have any questions, concerns with Mr. Hoskins? Hearing none. Thank you, Lloyd. Appreciate it. Next up, Dr. Duckett, he is not in present and I don't see him on the computer, so we had no updates. Riley in the building that I don't know of. Riley not on the big, I know there's a house fire down on the south end. He very well could be involved in that. He does have 3 resolutions. JP1, authorizing the chairman of the Cayuga County Legislature and the Director of Emergency Services to accept the New York State Division of Homeland Security and Emergency Services, Federal Emergency Management Agency, FEMA, hazard mitigation grant to update the Cayuga County multi-jurisdiction all hazard mitigation plan. Obviously, the resolution is on the packet. There was a fairly large amount of money attached to it. I think this find real quick. Yeah, the way I see this, looks like, increased revenue account A3647044349, in the amount of $106,613.25. Increased expense account, A3647454575. And that amount would be $142,151. And with the $35,537.75 coming from the general fund balance for required local share match requirement. And it says in the resolve, this resolution takes effect immediately. So for JP1, I'll need a motion. I have a motion and a second. Any discussion on JP1?
So how much money are we actually receiving in the grant then? Half of that amount?
I'm just reading what,
Getting 106,000, doesn't it look?
yeah, it looks like a total, whereas the grant funds awarded to Cayuga County total $148,037.75 with the federal share of 106. And there's a 25% non-federal matching share of $35,537.
So the 50 some thousand would be the 25.
There's an addition, if I could, Mr.
Yeah,
Chairman.
yeah, sure.
There's an additional $5,886.75.
For man.
It's coming from a match from the management costs of the grant. So there's a grant, the management costs, the local share,
Right?
that adds up to 148 and change. Is that where your question is?
Yeah, that's,
Okay, because math doesn't look like it adds up and
no, that's.
back to the,
But I mean, we're getting this money, but it's not absolutely free.
No. There is a match.
Can I ask a question?
Yes, ma'am.
Is this a new grant? Because we didn't anticipate it and all of a sudden we're going to take it. I'm not saying it's not worth it, but we do have to come up with a $35,000 draw from the fund balance to do it. Lynn, do you know much about this grant?
This is the second time we've received this grant. We received it when we also did the initial plan, the initial hazard mitigation plan. It was several years ago. So now they're getting another round to update it. And I believe the last time it was the same. It had a local match in it the last time also.
Okay, so it's no different than the one we had gotten before.
No,
Except
and there
2
was a
years
match
ago.
in it. Yeah, I mean, it was several years ago. So no, I don't know that he knew when he would get awarded this. So we certainly didn't budget for any of a local match and he wouldn't have known how much he was gonna get. I don't think either.
According to the paperwork, I think this, if I'm reading it correctly, this is number 2 of 3 different grants. Is that correct, Lynn?
Well, they don't have anything to do with each other, though. This one is the plan. This is the plan
Right.
update, which is very different than the other hazardous material ones that usually are 100% funded. Where we buy different supplies for this 3-county team. That's kind of different. This is the actual plan. And that
Yep.
does have the local share, 25% in it.
And Lynn, I would assume if there was 35,000 in his budget to cover the match, you would have thought of that. So it's the fund balance or the contingency account.
Yes, he doesn't have that type of funds in his accounts. No.
Okay, any other discussion on JP1? Hearing none, all in favor? Aye. Any opposed? Carried. JP2 is along the same lines. It's authorizing the chairperson of the Cayuga County Legislature and the Cayuga County Emergency Services Director to accept a New York State Division of Homeland Security and Emergency Services FY 2024 Hazardous Material Grant Program grant to enhance the equipment and technology of the Cayuga County Hazardous Materials Team. I need a motion for JP2. Have a motion, I need a second.
Second.
Motion and a second. Any discussion on JP2? Obviously, the resolution's in the thing. This is a grant applied for provide purchase of dedicated equipment for the Tri-County Hazmat Consortium supporting Cayuga County, Tompkins County teams. These are handled basically through the Auburn Fire. And we accept the grant, and I think the money goes to Auburn Fire to, support their team with equipment. And this is, increased revenue account A36470443348, in the amount of $81,900. And then the expense account, A36474545574, at the same amount, 81,900, and I do not see a match in the resolution. So I need a motion on JP2.
You already have it.
you have the
Oh,
motion.
I got it, everything? Oh, any other discussion? All in favor?
Aye.
Any opposed? Carried. JP3, authorizing the chairperson of Cayuga County Legislator and the Cayuga County Emergency Services Director to accept the New York State Division of Homeland Security and Emergency Services FY 2023/2024 hazardous material targeted grant to enhance the equipment and technology of the Cayuga County Hazardous Materials Team. Again, that team is operated through Auburn Fire. I imagine without Riley being here and what little bit I know, he'll get the funds or accept the grant and it'll be turned over to the Auburn Fire Department. I need a motion. Need a second?
Second.
Any discussion? Okay, I have, resolution here in front of me. It's, increased, revenue account A36470444347 in the amount of $260. Increase the expense account A36474545573 in the amount of $30,260. Any other discussions on JP3? Hearing none, all in favor? Aye. Any opposed? Carried. That's it for emergency services. Next up, be the sheriff, Brian.
Afternoon. I don't have anything to add to my report, but I just wanted to mention, the broken record I keep coming back each month with, but we lost 2 more members in jail, 2 more officers, 1 to retirement, 1 to resignation. So we continue to have some major challenges in the jail. We basically have a staffing crisis in the jail, which is pretty obvious. It's impacting our budget with overtime. I'm really concerned about the amount of hours people are working. What makes it real challenging right now, we're down 13 positions. We have 3 people in the academy. We did have 4, one of those individuals resigned, but we have 3 people in the academy. It's a 12-week academy, so we're covering those shifts with overtime while they're in the academy. We have to send them. We also have 5 additional people that are either out with work-related injuries or some type of illness, somewhat long-term, some longer than others. So we really have to work on this issue. They're out of contract. We are negotiating, but I think we need to make sure that we're really taking this situation serious, because what my concern is, if we lose too many more people, I have talked about this at previous public safety meetings, but we're going to have to look at strategies to push people out of the jail. It's going to cost us money for boarding, potentially pushing boarders out, some if not all. That's not too many more people. If we lose them, that it's going to seriously impact our budget in a negative way. So I just want to be very clear that we've got to work on this. I did mention to the personnel committee last Tuesday that I think we need to work on some professional recruiting strategies. But at the same time, we have to have a contract that, is compatible to neighboring counties that will attract people, help us retain. I mentioned in the fall last year, I wanted to try to work on some retention strategies with some of the senior people that were leaving. We lost 13 people last year. We've lost 7 to date. And as far as senior people, we lost 8 to retirement last year. We've lost 4 to retirement this year, and I anticipate additional people we're going to lose to retirement because we really aren't offering any incentive for potential retirees to stay. So I just bring that to you because, I could lose a few more people and we're going to have to start pushing people out of the jail. It's going to have a significant impact on our budget. So I hope that we can continue to try to aggressively work on a contract that, is fair to both sides of the issue and will help us recruit, retain, and maybe start working on some professional recruiting strategies. But we have a staffing crisis that we have to address in the jail. I'm just very concerned about the amount of hours people are working, getting stuck. It's not sustainable. It's not good for them. It's not good for us. We've got to take this seriously and address this staffing issue. So,
Brian, if I may, I know when we talked the other day at the 2 State Street during the budget meeting, we talked about maybe reaching out to every base up at Fort Drum, anybody that was leaving or part-time work or whatever. Did I catch a blurb something about that?
we have set up a recruiting table there before at one of their recruiting events, and we do occasionally have some individuals reach out, but more so for the road patrol positions, not the custody side, not the jail. But we need some help with recruiting. I hope that the HR department can help a little bit with that. I think they've been tasked with looking at that, but I'm concerned we've also got to have a contract that will attract people as well.
Okay. Lane, have you heard anything about contract? I don't think,
I'm not on the CX team.
I don't know. I haven't heard anything either. So is it ongoing and
It is, and I know we can't discuss the
Yeah, right.
in this forum, but we are meeting again next week, but I just want to bring that to you because I see, some additional challenges moving forward if we can't get this addressed. They're going to impact us, financially.
okay. That was Riley calling me. I don't know about it. Go ahead. Yeah.
I know you said there's 13 positions and you've shared with us the overall staffing pattern, but just to quantify, is it like, I know that's a big chunk of your staffing, but how much of it is it? 30%, 40%?
Total positions?
Yeah, just to get I know it's a lot.
There's 96 budgeted positions for the jail.
Okay, and 13,
That includes administrative staff and everybody.
but the 13 are security positions?
Yeah, correct. And then the people that are out and the people in the academy are line staff as well.
And the people out on leave are part of that 13?
No,
Or
that's
no?
an addition.
Okay, yeah.
It's really like 20.
13.
Okay.
So that's making it extremely challenging. And I'm, again, if we lose, we have to look at it. It's something we've got to safely maintain our facility. So we're going to have to look at pushing people out. It's going to cost us some money.
Yeah, 25% significant.
Texting
Unfortunately,
Riley.
that's just the continuing theme, and I keep coming back with each month, but it's not getting any better.
Well, we'll definitely have to take a look at that and put our best foot forward on it. Sheriff, I know you have several resolutions. I'll start with them and
I have 4. I have, the first one is resolution to accept the grant from New York State Canal Corporation to help fund our navigation operations.
Move it.
I have a motion. I need a second.
Second.
Any discussion on JP 7? Hearing none, all in favor? Any opposed? Carried. Next one, JP 8, sir.
The next one is to amend a contract with the Port Byron School District for our special patrol officer. It's to increase a salary by $1 per hour for the special patrol officer. This is also the first contract that we had that we did not have the administrative fee incorporated into the contract for the school to pay, like all of the other school districts do. So we are renewing this contract. It had expired, and we are updating it with the 15% administrative fee along with the $1 increase for the special patrol officer.
I need a motion.
Move it.
And need a second.
Second.
I have a motion and a second. Any discussion? Hearing none, all in favor? Any opposed? Carried. JP 9, sir.
That is renewing the contract with Offender Watch. It's a digital platform that we use for sex offender management. It also gives the public the ability to search online for sex offenders, and it offers a number of other tools that they can utilize relative to individuals that might be living in their community.
Need a motion.
Move it.
Second. I have a motion and a second. Any discussion?
Does they have a map where they're always located?
What's that?
Does it have a map where they're always located?
As a map where they're registered,
Right.
where they're supposed to be.
Yeah, well, that's what they're supposed to be.
Sometimes they're not. We deal with that too.
It would shock you. Okay, I've had a motion and a second and discussion. All in favor?
Aye.
Any opposed? Carried. Last one, sir, JP 10.
Last one is to purchase one drone, to replace a drone that's becoming outdated or has become outdated.
I need a motion. I'll second it for discussion. Anybody have any questions concerning the drone purchase? I know there was some issues earlier.
It's in the budget, right?
The money is going to come from
The telephone.
Telephone account.
yes.
Fred, wasn't there some discussion about that?
Yeah.
Telephone account, whether it could be used,
There was, yeah.
and you were not correct? Oh, I just wondered.
Wow, kind of put it out there.
There's a disagreement.
Okay.
Tom Mitchell from the Sheriff's Association, a man I respect a lot.
Mhm.
He has a different position that the monies can be used from that account.
I think I probably I asked the question, could are these monies restricted? Could they be used to offset operating budgets?
Mhm.
And then you looked it up and said, gee, it looks like they have to be spent on inmate related
Right,
purpose.
but again, Tom Mitchell,
Yep.
a man I respect a lot, says they can be used, so.
Can I speak to that?
Yes, sir.
I think that there's some confusion relative to inmate commissary accounts. There's
Okay.
very strict regulations relative to commissary accounts that they have to be used for the betterment of the incarcerated individual.
And that's not phone.
That is not, and again, Mr. Mitchell does have that differing opinion that I also agree with. That there's no restriction on this particular account. There are on commissary accounts. There have been, it's rare, but there have been counties who have mixed the funds. When you do that, it restricts it to the commissary rules.
Mhm.
We don't mix those accounts. They're two separate accounts.
And you have 3 accounts, Sheriff?
One commissary and one telephone revenue account.
Oh, there's not another one that somehow I thought in my head there was
We do have some drug seizure accounts.
seizure, yes.
Separate from.
Which is entirely distinct. But since the sheriff brought it up, there's a 1988 state controller opinion that takes a different position than Mr. Mitchell. I have relied on that. Mr. Mitchell has relied on his opinion, and that's where we are. So I guess it's up to this body to decide that.
And just if I could add, I know in the past, we have just items from the inmate account or phone account in the past. We have done that here at this body. Okay, any other discussion on JP 10? All in favor? Aye. Any opposed? Hearing none, carried. Anybody have anything for the sheriff? Hearing none, thank you, sir.
Thank you, Mr. Chair.
I do have one other item. It's the Stop DWI folks. Deb Dennis is not going to be with us this evening. She did let me know that there is she does have a resolution. It's JP 6 authorizing the chairperson of the legislature and the County Stop DWI coordinator to enter into an agreement with Flex local media to promote Each County Stop DWI program.
I'll move it.
I have a motion. I need a second.
Second.
Any discussion on JP 6? Hearing none, all in favor?
Aye.
Opposed? Carried. One last thing that I have for this committee is former legislator Charlie Ripley is sitting in the back. He is with us this evening. So some of you have been around long enough to know Mr. Ripley. Him and Fred, did you get everything squared away?
We did.
And do we need,
We have a path forward that I worked with Mr. Ripley on, and he's going to pursue that. And I would expect to hear back from the not-for-profits attorney, and then we'll see where we end up from there.
very good. Charlie, thank you for bringing that to us and hopefully we can make the, that little minor,
Oh,
little thing happen. I think it'd be a good thing for the youth. So, thank you. Anybody have any other things to bring forward to this committee? One last thing I do have, we have an executive session. So I will need a motion to go into an executive session with, some invites would be the sheriff, Lieutenant, Franklin, and who else?
Ben Guzalak
Ben Guzlak.
and
And
attorney Steve
yes, I'm sorry, I didn't mention him. He is sitting back there.
sitting back in the corner.
Yes, so I will need a motion to go into executive session.
And the topic would be pending or current litigation, and there'll be a brief one on purchase or sale of real property.
Is it just the committee?
All legislators, anybody that's a legislator. All of their president.
that right.
I got it right.
I got a motion, I got the motion, I need a second. I'll second it. All in favor? Aye. Okay. Head over,
Are we
hopefully it will be short.
meeting?
We're going. No, it's just.
No, it's.
And I'm going to adjourn, KPS. Do I have a motion to adjourn? So move. I got a motion and a second. Adjourn.
Aye.
Aye.
All right. I'm gonna call to order HHS. Attendance, Eileen McNabb, or, Elaine Daly,
Present?
Eileen McNabb Coleman is excused, and Vitale, Tom Wenzel.
Yes.
Can I have a motion to approve the minutes, from April?
But
Second?
All in favor?
aye.
Carried. There aren't any appointments. We can start with department updates. We can start at the top with the health department, please.
Good evening, everybody. We have a handout for you. Dan is going to bring around. Actually, I'll pass it if you want to explain. Does that sound all right?
So for those of you who were on committee last year, I started in the fall trying to give year-end program summaries for some of our grant programs that we have. And this one that Kathleen's passing around is our year 4 progress for our Healthy Neighborhoods program, which is New York State funded. It aims to reduce in-home risks related to common hazards such as fire, asthma, lead poisoning, injury, pests, and indoor air quality. We are going to be entering year 5, hopefully very shortly, but so far we've improved 200 homes last grant year. 500 plus residents were reached. We've attended 30 or more community events to try to engage with community partners, and we've made 40 agency referrals to assist residents with other needs that we've identified when we've been in the home. Originally, when this grant started, we were targeting the city of Auburn and the towns of Mentz, Montezuma, Troop, Conquest, in the village of Port Byron. We were able to expand eligibility basically to the whole county based on certain eligibility criteria. So a child in the home, an adult over age 60, someone with a disability, things like that. So we try really hard to get into as many homes as possible. And part of why the program is so successful is because we partner with the Auburn Fire Department. So when we go neighborhood canvassing, door to door, outreach, things like that, we don't look like we're just someone else trying to sell something. We actually look like we're providing a service because we go with the fire department and they're in uniform. And so that helps build our trust and credibility. We give out cleaning supplies, child-proofing kits, shower grab bars, smoke carbon monoxide alarms, dehumidifiers, HEPA filter vacuums, wet mops, and more. So everyone gets like a standard kit, and then based on the home assessment and the home visit, we tailor the package based on their needs. So if there's a child in the home, they get the child-proofing items. If there's a senior in the home, they might get injury prevention related to slips, trips, and falls. A couple of things to highlight. When we did our home visits, we detected 56 in-home gas leaks this year alone, either through when we were installing the smoke and carbon monoxide detectors or the fire department's meter alarm that they have that they carry with them. So ISAG and potentially city code enforcement would have been called on those. And then in addition, the Auburn Fire Department confirmed to us, and I think we've shared this before, but I like to reiterate it because I think it's very powerful, that when they responded to 2 fires this year, the alarms that were alerting were installed by our program, and everyone was able to evacuate those homes because of the alarms notifying them. So I think, hopefully this provides a good summary of the work that we're doing, and we'll keep trying to give these short little snippets of the work that we do.
Great, thank you.
Yeah, it really is a great program. And I think a lot of our fellow departments know more about it too, and referrals as well, which is great. We appreciate that.
You mentioned at Board of Health, this is, it got a year or more to go, and this is kind of risky in your mind about losing funding?
So the New York State budget right now does not have Healthy Neighborhoods as part of it. And we have started year 5 of a 5-year grant that happened to coincide with a vacancy we had. So the pause is something we can live with, but if we're able to get back the funding at minimum, hopefully to finish up year 5, but certainly we continues. It would also coincide well with one of our fellows who's familiar, so it could work out well to bring someone right into it if the funding.
And the person to be fully aware that the funding is at
Oh,
risk.
that's.
Yep,
yeah.
that's what you had said.
That's always known, yep. Just a few more updates. I think, that's the lead story.
Mhm.
Vacancies, we're still working to fill some, just to share with all of you. We do have some good applicants for the lead registry outreach and education person, so hopefully we'll fill that soon. Director of Environmental Health is still vacant, nursing position vacant. You'll see one of the resolutions today is to fill what they call a content professional authority or a nutritionist within our WIC program, which would be funded through a grant. And then this public health educator position that just recently vacated that was affiliated with this program. So we'll be talking more about that in the future as well. But good news is we had a few people start this past Monday. Our part-time engineer started work, a sanitarian, and our environmental health technician for our lead registry program. And I really want to give a good shout out and pat on the back to our environmental health staff. Everyone does a great job. Everyone does. But we had the most significant amount of vacancies at this moment during a time, not only in the leadership position, but also in the field and the experience position. And our more seasoned staff are really working, not only working hard and doing a great job, but they're really working hard to connect with our newest staff members. It's hard to do your job and orient and show people, right? It takes a little longer, but we're really promoting that and staff are doing a great job trying to make that. So it's gonna be a tough year. Hopefully a better second year. By year 3 should be really good if it all stays in place. So we're playing the long game. New York State budget, as you all know, not passed yet. We're hoping soon. And so we'll see what that means when that passes. We got a little bit of kind of a precursor of information about the federal budget, but it was very, very nebulous simply because you're saying just because what's proposed, there hasn't been enough back and forth about what may come of it. So really, we're going to wait and see what's happening as far as our federal budget. I can tell you what's proposed is not really fantastic for public health, but we'll see what actually rolls out. And then rabies program. All right, this is a season where things are starting to pick up a little bit more in the warmer weather. We've had some conversations and we'll address this a little bit more, when we present it at Ways and Means, but we're constantly looking at all our programs, ways to control costs. And one of the ways we're looking to do that, we'll talk next month about maybe hiring a second rabies coordinator part-time. That could really help us because right now we have a wonderful rabies coordinator, but we are having to use staff to balance that out. So this person has time off, right? They are not available to us 365, 24/7. So this could be a cost-effective manner to do that. Also, 2 of our staff members went through necessary training and vaccination and have started to prepare our bats for us in-house. We used to have to send that out and pay a contractor, and now they are preparing those specimens themselves, which we appreciate. I'll probably think of 3 or 4 more things to talk about with you afterwards, but that's what I want to say. On our YouTube channel, there's not only great testimonials about our Healthy Neighborhoods program and people who've actually had it, and you also saw a letter, a thank you note that someone had sent to our staff members, but there's also really good information in other areas, including how to catch a bat, which it makes a big difference, and everybody wins if we can test the animal and not have to have treatment. That's all I have for updates.
How to catch a bat, call someone. Yeah.
Don't stick with the tennis racket. Don't do that.
Can I just say something? I want to congratulate Kathleen. I've seen on TV the advertisements pertaining to
just lead.
Good.
Very effective, very effective. They're simple. There may be half a dozen slides. There's not a whole lot of in-depth. I don't mean that wrong, but I mean, they're easy to read. I mean, you see.
Cater to
children-
the audience, yeah.
It's so good. And every time it comes on, I'm proud that we're doing it that way. So, thank you. Great, fantastic. I was really impressed. So
I'm glad.
I see it all the time. Like, yes.
That's wonderful. And you know, I'll pass it along specifically to Melissa Field. She's really our point person for that project.
Very effective.
She does a great job.
You're seeing it on TV? Uh-huh. Wow.
You should see some, you'll be eventually see, the television commercials are one thing, there's some radio, and you'll probably see some bus ads also.
Okay.
Great, good, thank you.
Hans?
I do have a question. Constituent called about the septic tank inspection. His house burnt down completely 4 years ago. There's an empty lot. He's been given a certificate to sign. He refuses to sign it because it gives the county access to the land whenever they want. He doesn't like that part of it. He says if you guys look it up on the property records, it's listed as vacant land, et cetera, et cetera. So what's your position on that?
I would ask that person to call our office and speak with one of our staff members. They certainly can call and speak with me, and then we can get the necessary documentation that we need for our files.
Well, are you going to do anything further if he refuses to sign? That's the question.
That's a good question. I'll have to look into that. I don't have an answer for you today.
Okay. Thank you.
No other question?
Do you want to do the resolution?
Yeah, we'll get into, you have two resolutions if you want to introduce them.
Yep, our first one is a request to fill either a competent professional authority or a nutritionist for our WIC program. It is fully funded through our WIC program grant.
Move it.
A second?
Any discussion? All in favor?
Aye.
Any opposed? Carried.
Thank you. And then our second resolution today is related to a lease agreement for our WIC offices with ABC Cayuga. We mentioned it last month. They really work well with us, and they are looking to continue the lease, which would coincide with the grant period that we have for the next 14 months. And it was a 2% increase. We do have the money in our grant to fully fund our rent.
Move that.
Second?
Any discussion? All in favor?
Aye. Aye.
Any opposed? Carried. Thank you. Lauren Walsh was unable to attend. She didn't have any updates. There is one resolution that HH6 is authorizing the creation of a temporary leave bank for a Cayuga County mental health employee. We would,
I'll move that.
okay.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Great. Thank you. Next, Christine and
Can you talk a little bit?
yeah, do you have, I don't, we have a report, but if you have a couple updates for us, that'd be great. And then we have two resolutions.
Start out with a little bit of data. We have emergency housing census as of last Friday was 115 singles and 29 families. We've been going a little bit down. The last day that we had a code blue deemed temperature was May 1st. I said, today I wrote this up and I said, I think it's safe to say we're done with code blue, but then we're in it.
Is that later than you normally see it, May 1st? Yeah.
Yeah,
That's
yeah. We had in April, I think it was between 7 and 10 days that were, code blue.
Wow.
Yeah, and then this May 1st, I think we're done.
Hope so.
So yeah, knock on wood. I did want to talk a little bit about the like staffing vacancies issues with caseworkers and to kind of honestly parrot some of what the sheriff said. Like we're in a staffing crisis with our casework vacancies. We have 7 vacant out of 24 positions right now. That's 29% of the caseworkers are vacant. We have not been seeing very many applicants. At one point, we had no applicants, which was unusual for a bit of time to have absolutely no one that had applied for caseworker positions. Just kind of talking a little bit about the impact of having too few caseworkers. It leads to very high caseloads for the workers that we do have. There is no relief to the number of cases that we have coming in based on our staffing. The number of child protective reports that come in don't slow down based on our staffing levels. The number of APS referrals that we got have been very high and continue to come in fast and furious. Again, doesn't matter where we're at with staffing, we have to do the same work with those families. The statutes, the work that we're required to do remains the same. And then again, the same impact on foster care and preventive. Burnout, I'm very concerned about burnout of the workers. You know, they are trying, but when they're stretched very thin, it just leads to, you know, not really having the ability to do best case practice on cases. That's not where we want to be with our quality of work for sure. And then also impact that it has financially on the county when you have casework staff that turnover often. We have workers that come, don't stay very long, quit. We have, you know, high caseloads. Talking about a delay in casework being done, delay in permanency for children, even a few months extra time can cost the county local dollars and have an impact. So help with recruiting ideas, you know, it's, you know, if there is the possibility to have some sort of professional recruiter like the sheriff was talking about, I would be interested in that as well. And I think that not having a contract, CSEA contract also has an impact on people's willingness to kind of come in without knowing what the forecast is for what they would be potentially making and earnings for the next few years. So I did want to talk about that because I think that that's something that I'm very concerned about and has been something that we've struggled with ongoing. We haven't had full casework, all of our casework positions full since in over 2 years since we left county office building. That was the last time. And I think that some of it has been kind of attributed to the, situation of not having a building. We had a pool of workers that we had hired at the beginning of our displacement, and our ability to get them trained and give them the support that they needed was very much impacted by not having a space to work and for them to feel like they were part of the team. And we just have never been able to kind of get on our feet again with like having all of the workers positions filled. So right now. I'm going to read something that just because I want to hit on some points and not just not miss them. So I'm going to read a little bit more than I usually do this next bit. As a follow-up to the 2025 year-end budget information that Grace presented at the Ways and Means meeting last month, I met with Chairman Anna, Legislator Sergeant Winslow, and Daly, and the Budget Director and Director of Finance on April 30th. The purpose of the meeting was to talk about the DSS programs, the 2026 budget, and pressure points in the DSS budget that have the most potential to go over budget, and to see if there were strategies that could possibly be put in place that could help with our performance of this year's 2026 budget. The program area that we talked about most, I'm sure you're not surprised, is foster care. I talked about foster care programs in general. I talked about the cost of foster care placements,
how costs have escalated dramatically in recent years, especially for youth that are placed in residential facilities. And we talked about factors that impact the local cost of a youth's placement in foster care. I talked about strategies that DSS already has in place to monitor the foster care program, who's in foster care, what the circumstances are that led to that child being placed or those children being placed, under what mechanisms like Child Protective Services or juvenile delinquency, what mechanism was used to have the child come into foster care. We talked about statistical data that we have about the youth who are in care now, a little bit about history, trends over time, and expenditures per youth and expenditures for foster care overall, monthly or yearly. We talked about our locally developed reports and the state system reports that are available to us to keep track of and analyze all this information I just talked about for the youth that are placed in foster care, including those that are placed at the most expensive foster care setting, residential placements. We talked a lot about how DSS management monitors and provides supervision to the foster care caseworkers to be sure that Department of Social Services is placing youth at the lowest level of care that is appropriate for their needs, and that DSS is working hard to achieve permanency for children as quickly as possible by going back home, being cared for by kin, or possibly adopted if they're not able to go home. We talked about things that could impact where a child is placed when they're in foster care, what makes certain youth unable to be programmed for at that lowest level of care in a regular certified home. We discussed how certain case circumstances or children's behaviors can significantly impact a child being able to be discharged from foster care. At the meeting, I shared some of the action steps that DSS has implemented to bolster even further the upper management level oversight in the foster care program area. For example, every Monday, the Director of Services in the Children's Services section will be meeting with the foster care supervisors and caseworkers to discuss where things are with every youth that's placed in a residential placement. Action steps that will be taken that week will be determined and will be reviewed at the subsequent Monday meeting. There has been significant casework turnover and vacancies in services over the past few years, and the lack of continuity in a caseworker being on a case can certainly lead to negative impacts on service delivery and achieving permanency. The enhanced consistent oversight at the Director of Services level will help drive the casework action moving forward, provide an opportunity to more frequently brainstorm solution when barriers are identified. The meetings were happening monthly, so this increase is can be 4 times a month, 5 times a month versus once a month.
That's the steps you're taking right now to increase that oversight.
So we moved it from the once a month to 4 or 5 times, depending on how many Mondays we have. Another new strategy is that monthly, myself and the Deputy Commissioner are going to be meeting with the Director of Services to also review detailed information about every youth placed in residential placements. We have worked on an expansive report that includes a whole lot of demographic and information about the situation of the youth, why they're in care, what the challenges are, where they're placed, how much it costs, things like that. But the report also includes information about the barriers to the youth going to a level care and action steps that are being worked on. And again, this is really an opportunity to continue to brainstorm solutions and just keep going, keep moving forward, and keep looking at what needs to happen to achieve permanency for the child. We are working with an interested individual who has the credentials required to be a qualified individual to complete qualified assessments for us for youth placed in the QRTPs. This process is really the state's oversight of youth placed in QRTPs to make sure that this person doing the assessment is taking a look at whether the child needs to be at that level of care. We currently contract for this service with Cayuga County Mental Health, but we've decided that we want to have an additional resource available to us since it's a very critical assessment and it's a very time sensitive assessment, and
We have no flexibility on when it's to be completed. There's no like flex in that window of time. So having someone else who can be on board for us to tap into as a resource, we think is going to be very helpful and potentially help us with, not getting in a jam on those QRTP.
Good, because we talked at the meeting, one day off schedule on that initial assessment or once every 6 months, you miss 1 day deadline and you lose some federal funding.
Yep.
And that's why you're really
Mhm.
making sure that there's
Right.
no,
Right.
if
And,
possible.
mental health has been good to us, with having a worker available, but just not having all our eggs in one basket and having someone else that can also
Yeah.
be tapped into to do this, I think is going to be a good step in the right direction. Additionally, we have requested already to have a meeting with the Cayuga County Family Court judges. We'd like to give them some information about some of the challenges that we face. And we'd like to hear their feedback about ways they, think that DSS might be able to improve our practice in achieving permanency for youth from their perspective, from what they see when we go into court on cases and what we're providing to them as far as information and documentation and whatnot. So we think that I'm hopeful that we're going to be able to get that meeting set up shortly. The meeting that we had was quite lengthy. I think it was over 2 hours. I thought the discussion was well worth the time that we spent. I hope that everybody that participated did as well. And, thank you for being there and for, listening to everything we had to say and for your feedback. I think that I'm glad that we got together. At the Ways and Means meeting next week, I'll be talking about the DSS first quarter of 2026 performance to budget overall. And I will highlight a few of the key areas like foster care, and talk about what areas we're going to be monitoring closely as we move forward through to the next quarter. Because there's areas that we definitely are going to have to pay more attention to than others, but I'll talk more about that next week.
Okay, thank you. Questions? Yeah.
No question. I just want to say, I thank you and I appreciate that you reached out to me and then, at the meeting that we all had and sat in, I thought there was a lot of good things in conversation and information that was shared there. And I appreciate your, actions there, proactive actions that, some of them came about from the meeting and that was good. And it was overall the positive that came out of that. And I thank you for your efforts on that.
Likewise.
And your staff too, like you said, you're in a unique role where you can't just say, oh, our caseloads are full, we're closed, right? So I can't imagine the burnout and then also not knowing where the end is, right, for your team. So we're gonna have to think about how we can help support and make sure that they know they're appreciated. I can't imagine how tough that is.
We once talked about the possibility of contracting with an agency to bring in some additional staff, and the risk there is if that individual gets paid more working for a nonprofit, it'll just make everything totally worse. Plus you have the overall responsibility anyway.
Yep, we do.
You want to introduce your resolutions?
We have 2 resolutions tonight. We have, first one is HH4, which is for social services to accept state funding for the rent supplement program. This will be the second round of funding that we are interested in having for this rental supplement program. This is a program that utilizes the funds that we got, most of the funds that we got for actual supplementing the amount of money that an individual person or family pays towards the rent of a place that they have secured in the community. And the folks that we are giving this opportunity to for the program that qualify are people that are homeless or facing imminent loss of their housing.
I'll move that.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Carried. HH5?
Okay, and HH5 is to renew a contract with the Rescue Mission for the Homeless Family and Transitional Housing Program. This is they lease a building from the Auburn Housing Authority on Merriman. Rescue Mission does, and there are 8 units that are for families. And they provide case management for them and work with them towards finding permanent housing. There's a limit of 90-day stay. But within that 90 days, they work with them to try to identify permanent housing and, applications and securing a place.
It's effective June 1st for 12 months, right?
It is effective June 1st, 2026 through May 2027. One thing that I didn't tell you is that the 103,075, we actually can reduce that number to $95,040. That's
Okay.
what they're asking for from the Department of Social Services for this year. It's a drop from the 103,755. More fundraising to their Thrifty Shopper on their budget to be able to run the program of these units. They get substantial money through.
Rescue missions.
So when we
using some of
donate-
their funds to offset this?
We donate to them. Does it come back around? I give them a lot of clothes.
Me too.
Good, that's good to know.
Yeah.
So we can just make that
We have to
amendment?
amend it.
Well, we should move it on the floor first, and I think you've been a first.
And I'll second.
And then I'll move the amendment or friendly amendment or whatever you want to call it.
Reduce the 103 and change to 95,040.
Yes.
Sounds perfect, Fred.
I'll second that as well.
All in favor
Of the amendment, aye.
of the amendment? Any opposed? Carried.
And then the
Now
resolution
resolution.
as amended.
As amended.
God.
Can I have a motion to approve the resolution as amended?
I'll move it.
Second, yeah,
Any discussion? All in favor?
aye.
Aye.
Any opposed? Carried. As amended. Yes,
Yes, and I'll make the edits so they're available for Ways and Means.
we'll always amend backwards. Thank you.
Mhm.
That's good news.
Yeah, that was good news. That's all I have.
Thank you so much. All right, next we'll Office of the Aging, Brenda Ezeka. Do you want to start with your report?
Yeah, sure. So, you can see that, we talked about our volunteer, appreciation week. We were very fortunate to have an anonymous donor, give us, a gift card to purchase, things for the drivers to have at that week. And we put out coffee and our trio vendor provided some things. So that was really nice. And I included one of the thank you notes from the volunteers because they do appreciate being recognized. We are expecting the New York State Office for the Aging. They will be visiting us on June 2nd, 3rd for our New York State nutrition audit. Last time we had one of these was 3 years ago, and it was pretty overreaching, I think. They have already asked us for hundreds of copies of things that they want to review, but they're asking us to make all those copies and send them to them ahead of time. So I'm a little concerned about, it's pretty onerous for our staff, even doing a really very small department. So they're following up a little bit of the Aging about their process. We get 2 other audits here, and those do not have those same kind of heavy requirements. So, when we talk about our nutrition program, there's just a lot of work involved in doing that. But hopefully the things will go really well with our audit coming up. Again, we've continued to do staff training. Yesterday, or was it this morning? It was this morning. It was a long time ago. We visited a 3rd adult care home in our community, and it's really amazing how different the different facilities are. They're all licensed the same way. So it's really good for our staff to get out, to see the individual places and get a feel for the different locations and what each of them offers as we assist people to figure out what types of care, what level of care, what's going to be a good fit for their family member. Our senior council group, very active in this community, plan lots of trips, lots of educational events for their members. They come together every year to plan events that are open to the entire community. So this year, they are planning 3 events. One is meeting with Director of the New York State Office for the Aging, Greg Olson, and Becky Prevey, who is the Association on Aging Executive Director. So they'll be coming out to our county to talk with the seniors, and then they will also be coming to talk to the legislature. So I'm very excited about that. It's a really important year. You know, we're a lot going on with increased seniors, so number of seniors and a lot of innovative ways to help. So it'll be interesting to have them come out. We're also going to have the 2 attorneys that did advanced planning information. It's going to be offered again. That was a big hit, always is. You know, power of attorney, healthcare proxy, those really important things that people need to get in place. And then we're also going to they're going to do another program on strokes and something related to stroke prevention and stroke recovery they're looking to do. So more details are coming about that. And then, of course, our big plus is that we have our 2 senior citizens of the year that we'll be recognizing in Sterling. And this year, one of the recipients happens to be from Fairhaven. So it'd be lovely to be up there for that. So very excited about that. So I never wanted to have Danielle talk now.
Sure,
Okay,
sure.
So Danielle Schneider is a coordinator with our office, and she oversees the in-home care program. So it's ISA program, it's our Alzheimer's CSI program, it's our National Family Caregiver program. We get a bunch of funding streams. Everyone kind of has their own little requirements as to how we are able to help people. She's also oversees our in-home services program, which is kind of the same. We kind of combine them together, but she has a lot of different programs that she works with. She has staff under her that do the different programs. And so we wanted to have her come today to share one of the scenarios where somebody she's worked with for quite a while, and talk about a little bit how our programs help that individual and spouse.
Yeah. Okay, so as Brenda mentioned, my name is Danielle Schneider. I've been with the Office for the Aging now for 8 years. So I've been overseeing the caregiver program for about 8 years now. And I can tell you that 8 years ago compared to now, it's completely night and day to what I'm dealing with. So a caregiver is somebody who provides care to a person they love, whether it be an elder adult, a person with disabilities, or even children have disabilities. So I oversee the National Family Caregiver Support Program through our office. The main focus is to provide support to caregivers, primarily to individuals who are being cared for with cognitive impairments, such as Alzheimer's, dementia, multiple sclerosis, Parkinson's, and those things. So what I can tell you in my experience is caregiving is really hard. I don't know if anybody around this table is familiar with what a caregiver is, or if you have had a loved one that has a cognitive impairment, or a child with special needs. It's really hard that you're expected to, take care of yourself and also take care of this person you love. The tough reality is caregivers are the backbones to the system. They save our system billions of dollars a year, keeping people out of placement, keeping people out of facilities, which is ultimately the goal. I look around this table and not everyone's 25. I would bet your goal is you want to stay at home, right? You don't want somebody to put you in a nursing home. So
what? We're dead.
the average caregiver is 52 years old, which means that they're a sandwich caregiver. I have caregivers who work full time. They have kids at home, and they also have to care for their parent. The tough reality is it's not possible to do it all. So that's where the caregiver support program comes in. We are designed to provide information, assistance, respite, which I will get into more, counseling, and supplemental services. So our goal is to really provide that caregiver with a brief reprieve or a break from caregiving. I tell people that because we push that caregivers need to take care of themselves. The reality is in my 8 years of doing this, the majority of my caregivers pass away before my care receivers because it's so stressful. Caregivers stop taking care of themselves because it becomes so intense having to care for somebody with a cognitive impairment. A cognitive impairment means that the brain is not working well. So they require assistance with their activities of daily living. So getting up in the morning, going to the bathroom, eating breakfast, going to the doctor, making sure their clothes are clean, you know, so all of that falls on the backs typically of one person in the household, the primary caregiver. So I see a lot of really tough situations. Caregivers aren't calling when they're like, hey, I'm just calling to see what's available. They're calling in crisis. You know, they needed us 6 months to a year ago. So my goal is to come in to basically provide that brief break. The reality though is this respite isn't a break for caregivers. It's often just a means for them to continue their employment. It's a means for them to continue raising their kids. You know, so it's kind of a catch-22. We tell caregivers, like, you got to take care of yourselves. You know, you got to go to the doctor, you've got to maintain, but how are they expected to do that when the system isn't set up to be supportive? So one situation that I really felt was important to bring to the table was a caregiver I had worked with for over, I'd say 3 years. And then we've maintained contact because that's the thing about caregivers. I'm the sole caregiver support program in Cayuga County. So a lot of them will keep in contact with me after the fact because I am their one person through their journey. You know, sometimes we're working together for 10 years. You know, I'm working with them right through typically until their loved one has to be placed or they pass away. So when a person becomes a caregiver, there's a financial sacrifice to be made. A lot of times they have to leave the workforce altogether because that person needs 24-hour care at home. It's $40 to $50 an hour to pay for somebody to come sit with your loved one at home. It's not cheap. And it's not cheap to put them in a nursing home. So our respite funds are designed to provide that caregiver with a break, whether it be, you know, to get a break, which is very rare. A lot of times my caregivers are using it just to maintain their employment or able to do their own doctor's appointments. I had one caregiver though, he was taking care of his wife who was 55 at the time that she was diagnosed with Alzheimer's disease, which is considered early onset. And at the time when I had met him, this family resided in Cayuga. So at the time when I had met them, he had his own business. He was a contractor. He was physically bringing his wife on the job sites to maintain employment because he still needed to make money in the house, but he also couldn't leave his wife home alone. A lot of times dementia comes with wandering. So they have this ability that they want to go, there's a reason. So it's not safe to leave them at home. That's also what's hard is a lot of times they need that basic supervision, which it's not even, it's just making sure they don't run out of the house. It's making sure they don't burn the house down, so it's really tough. So I had originally connected with him because at the time, Cayuga County had what was called a medical adult day program. A medical adult day program was where you could send your loved one and they could receive, a medical level of care. So they could receive nursing, they could receive showers, medication, a meal, which is a huge financial, I say it's a bang for your buck because the caregiver gets a set break and the care receiver's in a safe place. It's virtually impossible to get aides in King Ferry and Sterling and Martville. And, the further really you go, the harder it is. So we were really lucky at the time that we had the medical day program. And I had a great relationship with Renee Becker, who at the time was overseeing the program. So she had connected with me. And with our respite funding, we were able to pay for her to go to the day program 1 day a week. And that's not much. Most caregivers on average receive 4 to 6 hours a week. I would say for 6 to 12 months, depending on the situation. But that 1 day a week was just enough for him to be able to go to work and to focus and know that she was safe. This was during COVID time, unfortunately. So COVID then shut the medical day program down. That has never since reopened, which is such a loss for our community. I have to tell you, not having a day program, is really.
Loretto?
Yeah, we don't, yeah. So, we were able at that time to transition the medical adult day to in-home. At that time, his wife's care had progressed. And so we were able to basically, instead of 1 day, full day a week at the program, we split it into 2 few-hour shifts. And we worked together until he exhausted the grant. And it was finally to the point, I remember when I first met him, he's like, Danielle, my goal is I want to keep her home. I want her to pass away at home. That's my goal. And so I said, let's try to work to make that happen. So once we exhausted our grant, which is very little, I really don't receive a lot of money. And it's hard to look at the amount of money and try to spread it across Cayuga County. Alzheimer's and dementia is exploding. People are getting it younger and younger, and it's a lot more intense. It's a lot more behavioral. My poor caregivers are really taking the brunt of that. So we were able to access Medicaid through spousal rules, and I won't go down the rabbit hole with that. It's not easy to get Medicaid, I will tell you, contrary to popular belief. A lot of Medicaid dollars are spent on older adults, trying to keep them at home and keeping them in nursing homes. So that's the tough reality of it. We were able to access Medicaid, and then I connected them with what's called the Nursing Home Transition Diversion Waiver, or the NHTD waiver, which is designed to provide nursing home level of care in home. Everything sounds great on paper, I will say. None of these services are easy to access. It took over a year to get these things in place. So a lot of times when I'm working with caregivers, I'm starting them on service with the understanding that let's work together to get something more longstanding in place. So we successfully were able to get Medicaid in place. We were successfully able to get the nursing home transition diversion waiver in place in 2021. Fast forward to March of 2026, I received a call from the caregiver letting me know that she had passed away and she never spent 1 day in a nursing home. And if it wasn't for the Office for the Aging, if it wasn't for the caregiver support program, he said he doesn't know how he would ever have been able to do that. I think the reality is, I know there's a lot of tough budget decisions to be made right now, and caregivers on paper aren't a mandated service, but I will tell you, in my position, it's so needed. And there's a chance that one of you, if not more of you, could be sitting in that position. And those programs, really make a difference. So I deal with a lot of those situations. I wish that was just one. I took a call today from an individual in King Ferry, and he's caring for his 58-year-old wife with Alzheimer's. So it's out there, and it's not cheap. But I say for approximately $6,000, we were able to offset Medicaid, and then it was a lot cheaper. I would love to see on paper what was spent in the community versus a nursing home at a tune of, $20,000 a month. So, I just thought it was important that I shared that story. Being in human services, you don't get a lot of wins when you're working against the system. So, I will tell you, it's obviously not the pay and benefits that keep me that keep me coming back here, to be honest. It's the people I serve. So with that being said, I appreciate your time.
Appreciate the work you do.
Thank you.
I think Danielle has one of the hardest jobs. There's a lot of challenging work at the Office for the Aging staff, but she gets some of the most heart-wrenching situations. and listens and really works really well with her. So I'll give her a lot of credit.
Not easy.
Nope, it is not. So I feel for anyone in those positions and I really try to make that, you know, I call it Schneider boot camp. I say that I take them under my wing and I empower them, you know, to be able to be a caregiver, and I meet people at their worst, and it's so gratifying to see in time, like how they kind of empower themselves, and, you know, it's pretty incredible to see. So, yeah, thanks.
Yeah, any other questions?
One resolution.
We have one resolution. Yep. Do you want to introduce the resolution?
Sure, so this resolution is for a position that's fully budgeted. It was the full-time position that was reduced to part-time. We did the cutoff, to try to save some money for the beginning of the year, but it's really important that we have enough staff in the building, especially over the summer when people are taking time off and stuff. We just don't have enough people to cover all the calls and requests for assistance coming in. So this position will help with that.
I'd like to move it.
I'll second. Any other discussion? All in favor?
Aye.
Any opposed? Carried. Great. Thank you. Thank you again, Danielle.
Thanks for your time.
We just had one more. Was Deborah Dennis. She couldn't be here. Her last day, I think, is Friday, so she'll be very missed. She gave us some updates and she did not have any resolutions, so just wanted to wrap that up. And then if I can have a motion to adjourn. All in favor?
Aye.
Go. Hmm?
Yes, thanks, John.
Time you got there, Bob.
Yeah.